Hey guys, Trista here for our weekly video number 6 for Group 6, talking about the articles that we read this week, the application of EHR in healthcare from 2010 with the International Conference on Multimedia and Information Technology, and the MedCity News article from Leapfrog for 2017. So basically talking about the electronic health records and how there's so many different sources out there for the systems. There's different standards of procedure. There's different versions of the systems for different healthcare settings, such as the lab, the pharmacy, the clinician, etc. And basically the security concerns that having a unified system might bring, and also trying to find out a way that could potentially work to unify that if the healthcare companies, insurance companies, patients, and clinicians were able to come up with a new work design reflow. So I thought it was interesting talking about the privacy concerns in both articles and the improvements they saw in errors and data collecting for the past few years from the 2017 article. So basically showing that electronic healthcare records can work and can improve prescriptions for patients and clinicians, but also that we need to be careful the way we use them.
The use of CPOE in healthcare has been something really beneficial for many clinical areas and hospitals. But one point that I really wanted to bring out was what can happen if these medical errors continue to lead to fatal events. According to the article, 39% of potentially harmful drug orders were failed to send alerts, and 13% of that led to potentially fatal medication orders in 2015. And although this was somewhat an improvement from the previous year, it still doesn't do justice for how incredibly high these numbers are. I think that when it comes to CPOE, double or triple checking might not be enough, but instead to actually always double and triple check as well with the patient themselves. This can account for the actual prescription of the patient and if it will be right for them. Ignoring these potential errors not only can lead to fatal deaths and overdoses, but as well as many physicians to continue to misprescribe medications, which can lead to no decline in the errors.
In the short news, it is argued that CPOE is improving, but still misses fatal medical errors. And in the paper, the author states that the dissemination of CPOE systems are pretty slow around 2004, and this can attribute to physicians' suspicion with its value and accuracy. However, research shows that there will be less errors in the second or third year of participation, possibly because hospitals pay enough time to identify and fix process issues. From my opinion, this is similar with delivering a business information system to a company. Workers in that company may doubt whether it deserves the time and energy they spent to learn and fix the system. Nevertheless, the benefits of using such a streamlined software are usually visible only in the long run. This inspires us that we need time to learn and check the functions of CPOE system before officially putting it into use. In that way, we can improve the performance and accuracy of alarms and thus enhance the value of CPOE system.
In the article, The Application of EHR in Healthcare, we saw some advantages with using systems like CPOE. Some advantages are that it enables the administrator to obtain data for billing or a physician to see the trends and effectiveness of a specific treatment or report an adverse reaction. This allows a doctor or anyone with access to this information a complete picture of the patient's condition. Systems like CPOE have 4 different components: the administrative system, laboratory system, radiology system, and pharmacy system. All of these components are put together so that a patient's information can be found in one place by using an identifier like a medical record number. I personally find this system very beneficial when necessary because I am able to pull up my own information and get reports about my medication or my laboratory reports.
So this week's topic is focused on focused on electronic health records. According to the second article, the author describes EHR as a collection of electronic health information on an individual that can be shared across different information systems. Some benefits of using EHR is that it can streamline patient data more efficiently for the physician as all of their health data is collected. It also provides for evidence-based medicine. However, there are some implications of using EHR. The storage of this data is not well defined, and the question arises of how long the data should be stored for. Another implication is that how accessible the data can be and how the privacy of the patient is protected. The patient data that is electronically stored can be accessed by many during times of physician entering orders or lab and radiology data is inputted. In connection to the first article of CPOE errors and from lecture, many physicians disregard error messages that come up, and this causes for errors to occur, and sometimes physicians are just not using EHR effectively. To combat these medical errors, vendors should allow for their systems to be updated regularly to keep up to date to current standards.